Okay, hi, my name is Dave. I'm going to be doing an intradermal injection on Skip Rocker, born 1/1/1972. It is a ordered Man2 0.1 milliliter intradermal injection today. Report results to the MD in 48 hours. This order is for today's date, 1/28/17 at 0800. So I am going to verbalize the 6 rights of medication. I'm going to make sure I have the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. So at my medication cabinet, I would withdraw my medication, Man2 tuberculosis test, Man2. It has the appropriate amount of medication to withdraw the dose, and the expiration date is good. The medication, there's no cracks. It's not cloudy. It appears to be unopened, so that looks good. So I have verified it on the MAR, verified it when I withdrew it, verified it against the MAR. Good there. So now I would prepare the medication. I suppose I could do it at the bedside too. Either way, it would be a similar procedure. So I'm going to do hand hygiene. Got that done. Great. I'm going to uncap the medication, take a antimicrobial swab, clean the top of the vial. We'll open my syringe using the double OK method. Pull that out. I'm going to pull in 0.01 milliliters of air because that is the dose. I'm going to go through the center of the cap. Going to withdraw 0.01 milliliters of medication. Push any air back into the vial. Make sure I have no air bubbles. I have 0.1 milliliters. Okay. Going to do the one-handed scoop technique to reconnect this. Going to grasp at the bottom so I don't have an accident. Set that down. Okay. Approach the patient. Hi, my name's Dave. Can I see your ID band? Could you tell me your name and date of birth? Skip Rocker, 1/1/1972. Do you have any allergies? The allergy he has here is Celebrex. That allergy is not pertinent to what we're doing today. When I researched this, I would want to know if he's been exposed to tuberculosis, especially recently. There could be some bad side effects then. Hopefully he would tell me no. Okay. Might do hand hygiene again here. Do a third check. I do have Man2. Expiration date's good. And I have 0.1 milliliters. So I have the right patient, Skip Rocker, 1/1/1972, the right medication. It's the right time. It's within half an hour of the order. I have the right dose with the right route, and I'll have the right documentation in my MAR, and I would document that I gave the medication. So at this point, I would glove up. Would ask to see the inner aspect of the forearm for this intradermal. I would take my antimicrobial swab, open that, go in the center of the area that I'm going to inject and work myself out. Would let that dry. Double OK method. Bevel up. Okay, so going to pull the skin taut, go at about a 5 to 15 degree angle, inject to where I see the wheel, and I do see that. Pull it out at the same angle, one-handed scoop method. Grasp at the bottom. That would go into sharps. Okay, well, I could do it that way, I suppose. I would re-glove if I needed to get a piece of gauze onto the patient. Took my gloves off a little prematurely there. I'm not going to massage or rub the area in any way. And I would take my piece of gauze and apply it lightly over the patient if need be. Ask the patient, this hand hygiene. Make sure the patient's feeling okay. There's no adverse reactions. Make sure the call bell's within reach. And tell the patient he could call me if he had any questions or concerns. Document that I gave the medication, the route that I gave it, the medication, the dose, and the time into the patient's chart. And then make sure that I notify the doctor if I'm on the shift, or that there is a note in the chart to notify the doctor at the appropriate time. That's my intradermal injection.